Hey everyone, not sure about the COVID vaccinations? You're not alone. Let's talk. Hey everybody. Okay, so there's been some questions about whether this COVID vaccination is safe. Mind you, I am not a medical doctor, but I have done a little bit of research about whether the COVID vaccination is safe. And so I'm going to share real quickly what I found. An article by Bloomberg on January 17th. Common reactions that they've listed, and so that includes fever, headache, sore arm where you receive the shot, but they are pretty quick to kind of go away. I have also had some friends on my Facebook feed who actually got the shot and said that some of these symptoms that included also like body aches, fever, kind of lasted a little bit longer. I want to say a couple of days after receiving the first as well as the second shot. So kind of take note of that. And again, this is just on their personal experience. These are people I actually know who have received the shot. Others haven't received any kind of side effects aside from like just a sore arm. There's a study out in Norway that reported a number of deaths that occurred quickly after getting the shot. So again, I don't want to say that the shot caused these deaths. So there were 33 deaths in Norway, and this was in mid-January after these individuals received the Pfizer vaccination. All of them, all 33 people, were over the age of 75, and this also included terminally ill patients with only a few weeks or months to live. Okay, so these were individuals who were already kind of weak to begin with. They reported that the deaths occurred a few days after the vaccination, but there was no direct evidence or link between the 33 deaths and the vaccination that these individuals received. So what happened basically was because, they were already in a weakened state, the vaccination gave them these symptoms and that contributed to their deaths. So that's kind of what I understood. All of the underlying conditions, what they experienced was the nausea, fever, and diarrhea after receiving the shot. There were 42,000 shots that were given. Okay, so you can kind of look at how many out of the 42,000 shots that were given, 33 individuals who already had pre-existing conditions were the ones who passed away. Okay, in Germany, out of 800,000, 7 of these individuals who were all elderly died shortly after the vaccine. Okay, and they had underlying conditions such as the carcinomas, am I saying that right? Carcinomas, kidney deficiencies, Alzheimer's, and so they already had these conditions to start. In the United States, there were some allergic reactions, and you'd kind of expect this regardless. You're gonna give something to a bunch of individuals, someone's gonna get some kind of allergic reaction, and that's kind of what happened. 21 cases actually experienced anaphylaxis. So this was confirmed as of December 23rd. So I think that number actually went up. Yep. So that number, so from the 21 back in December, it kind of increased. Out of the 9 million shots that were given, 29 developed an allergic reaction. 17 of those cases already had a history documented about having allergies. 7 of those had a history of anaphylaxis reactions. Okay, so there are certain elements in the shot that can trigger an allergic reaction. So if you're prone to allergies or allergic reactions from vaccinations, then you definitely want to talk to your doctor about that. So on average, regular flu vaccine that's given like routinely, 1.3 times per million. So every 1 million people, there's about one person, 1.3 people that have some kind of allergic reaction to the flu shot. This is just a flu shot. So of course, based on that, we're going to probably expect that this new vaccine is going to cause some kind of reaction. If you have any allergies to any components of the COVID-19, maybe not get it. Or talk to your doctor. Always talk to your doctor. Don't listen to me. I'm not a medical doctor. I'm just giving you information so you have a better idea of whether you want to pursue getting the vaccination or not. Okay, so the other thing is if you're getting the shot, you want to be observed 15 minutes after receiving the shot. That's to see if you get some kind of reaction. And if you do get some kind of reaction, they can help you out. In the vaccination itself, they did list this one chemical, and I'm going to totally butcher it, but I'm going to try anyway. It's called polyethylene glycol, and that's sometimes related to anaphylactic reactions. But this chemical is also found in foods, cosmetics, and other medications. Okay, so this isn't something new. This isn't a new chemical that they came up with There was also a doctor, I know this was on the news, about this doctor who received the vaccine, was really healthy, had no prior symptoms, and died. So his name was actually Dr. Gregory Michael. He was 56 years old. He received the vaccine at Mount Sinai Medical Center and on the 18th, and he died 16 days later from a brain hemorrhage. So his wife, Heidi Neckelman, and this is from the New York Times, she said, his wife, that he developed an extremely serious form of a condition known as acute immune I'm going to really kill this one. Thrombocytopenia, which prevented his blood from clotting properly. Okay, they're doing more investigations on that. I haven't seen anything more recent about it. Experts who, I guess, were studying this case said it's very rare for that to happen. But according to his wife, Ms. Nickelman said 3 days after her husband got the shot, he developed tiny red spot or petechiae, but caused bleeding under the skin of his hands and feet. And so, of course, since he's a doctor, he recognized like, ooh, okay, not good. So they took him to the emergency room, and then that's when they did the study and the test. So they kept him for further kind of observation, and he unfortunately did not make it. So again, he had no medical issues, no underlying conditions, and his wife wanted to put it out there because she wanted people to be aware of possible side effects. Again, this is one case that they found out of, I think it was 9 million, right? So again, take this information and you need to discuss it with your medical provider to see if this is a concern for you. Dr. Jerry Spivak, who is an expert on blood disorders at Johns Hopkins University, who is not involved with Dr. Michael's care, said that based on his wife's description, Ms. Neckelman's description, Dr. Spivak said he thinks it is a medical certainty that the vaccine wasn't related. So I don't know. And that Dr. Spivak, again, who is, this expert on blood disorders, said it's going to be very rare, but it could happen again.
Okay, so according to NBC Miami News, they actually found that Dr. Gregory Michael had died of natural causes. This was published on April 8th, and that given his history and the autopsy, toxicology, laboratory report, they ruled his death as having been due to natural causes.
So, take that information. So he said people shouldn't stop from being vaccinated, and that COVID itself can also cause the same condition. So there's that in some patients. So again, everybody's different. You're going to react differently from, your friend and other people you know. For the most part, it sounds like people have been having just very mild reactions, side effects to this vaccine. Okay, I talked way more than I wanted to, but that's kind of what it is. If you guys want more information, let me know. I can do more research about this vaccine and get maybe more input from people who have started to get the shots. I know it's becoming more common now, and for those of you who have gotten the shot, I would love to hear your reactions so that I can share it with other people. Okay? All right, aloha everybody. Take care.
Thanks for watching. Make sure to press that subscribe button and turn on all notifications.